Okay, so activity 1 of your respiratory anatomy lab is going to be all on the mid-sagittal bust model, which I have right here, both closed and open. And so the first few structures that I'll go over first is the nose, which includes the bridge and the apex, the external nostrils, which are considered the nares, and then the nasal cavity. So I'll show you those three first. So here is the nose here is the apex at the tip, and then the bridge would be just this short section in between the eyes. Next would be the external nostrils, or the nares, which you can see in here and here. Those are an opening to the nasopharynx and the nasal cavity. So this right here again is the external nares or nostrils, or external nostrils or nares. That would be an opening to the nasal cavity as well as the nasopharynx. And then this is the apex of the nose, the bridge of the nose up here, and then all of this on the inside would be considered the nasal cavity. Now the structures that it talks about are the hard palate, which is all this bony structure here, so that's all the hard palate. If you remember from Bio 32, this is the maxilla here, and then the palatine bone back there. And then you have the cribriform plate with olfactory receptors, so you'll have to look from the top where that is. So here's the cribriform plate, which is part of the ethmoid bone, and the olfactory receptors would be in there. And then we have the nasal septum. So you have to look on the other half of this model. The nasal septum is the wall that is separating the two nasal cavities. And so this is the septum here. It's made up of the perpendicular plate, which is part of the ethmoid bone. It is made of the vomer here, which is its own bone, and then this cartilage here, which is hyaline cartilage. Then we have our concha. So this is Bio 32 review as well. There is a superior at a middle, and then inferior nasal concha. So those are the bony projections on the skull. Now your lab also references the meatuses. And so this is a meatus here underneath the superior nasal concha. Here's another meatus underneath the middle nasal concha, and then one last meatus underneath the inferior nasal concha. And so those are just the grooves that are underneath the bony projections. Paranasal sinuses, the only paranasal sinuses you can see on this model are the frontal sinus here and the sphenoid or sphenoidal sinus here. The other sinuses, which are your maxillary and your ethmoidal sinuses, those you can see on SliceMan, but you cannot see on this model. Now the pharynx is all of this area here. It is divided into three sections. So we have the nasopharynx behind the nasal cavity, we have the oropharynx behind the oral cavity, and then we have the laryngopharynx behind the larynx, so this space right here. Inside the nasopharynx, it does mention the pharyngeal tonsils, which are here. And then for the oropharynx, oral cavity would be the space inside the mouth. Then we already went over the hard palate, which is going to be the maxilla and palatine bone. And I go back and forth between calling it palatine and palatine, but it should be palatine. And then the soft palate is the soft muscular structure on the back, with the end here being called the uvula. Then palatine tonsils, I described this in the lymphatic lab video, but I'll say it again here. Here's the palatine tonsil or palatine tonsil. That is the only tonsil that we have a right and left for from your learn list. The pharyngeal tonsil is going to be just one, so you don't have to give left and right. This is a lingual tonsil. We only have one, and so you don't have to put left and right. The palatine tonsil, we do have it on either side, so you'll have to say right or left palatine tonsil. Then I already went over the laryngopharynx and oropharynx, and then the larynx. So here's the larynx here. First we have the thyroid cartilage, which I'll show you from the front. So this would be the thyroid cartilage here, made from hyaline cartilage. Part of the thyroid cartilage, now here it says thyroid cartilage Adam's apple. This Adam's apple should be below one line here. It should be next to laryngeal prominence, because that is what the Adam's apple is. So where the thyroid cartilage comes to a point right here where it kind of protrudes out there. That is the laryngeal prominence, which is also known as the Adam's apple, but do not call it the Adam's apple on the exam or else you will not get full credit. It is called the laryngeal prominence, and both males and females have it. Males is just larger and more prominent because of the amount of testosterone that males have. Next is going to be the cricoid cartilage, which is right below it, so a smaller piece of cartilage. That is the only one that actually wraps all the way around. Okay, so that both of these here on either side are considered the cricoid cartilage. If you look on here, this is thyroid here, and this smaller piece down here would be cricoid. Then we have the epiglottis. We're still on the larynx. This part K right here, that is the epiglottis. That is made from elastic cartilage, and that will bend when you swallow in order to cover up the trachea so that food is directed down the esophagus instead of down the trachea. And then we have the glottis. Now the glottis you can't really see on this model because the glottis is the opening between both vocal cords on either side, so you can't really show it on this model. You can see it on Sliceman, so I'll show you in another video, but the glottis is the space between the two vocal cords or vocal folds. That's it for the larynx, and then the trachea is down here where these C rings start. So these are all little dots here all the way down. Those are C rings, which are also made from hyaline cartilage. So the thyroid cartilage, cricoid cartilage, and the C rings of the trachea are all made from hyaline cartilage. Then the carina, which you can kind of see right here. So at the end of the trachea where it splits into the primary bronchi, that is called the carina, which is highly sensitive. And so if food or any kind of debris lands there, that is where you have spastic coughing that will occur as a reflex if food were to land down there. But that is the carina. And that is all for activity 1.